We're going to talk about a condition that causes a lot of abdominal pain, but more importantly, this could lead to actual cancer. It's a very painful situation.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.
Dr. Carrasco, we're talking about a condition that causes abdominal pain. There's a lot of types of abdominal pain, but this one could actually lead to cancer. Alex, it's called pancreatitis.
Pancreas sits in the middle of the stomach right here, kind of along the small bowel, and it mixes its juices with the juices from the gallbladder to create digestion, so you can digest your food.
Right. But whenever it starts eating itself, whenever the enzymes are released and they start releasing, becoming active inside the pancreas, is where you have this problem called inflammation or pancreatitis.
Well, this will bring you to the doctor because you're going to hurt. It's not one of those things that you can put off. You're going to hurt, and it's the kind of pain that brings a big man down.
Well, that's exactly right. Normally we see people at home or the emergency room, and they're sitting there leaning forward, that's the best way to be more comfortable. If they straighten back up or lay down, it's extremely uncomfortable. So they end up in the emergency room and usually end up in the hospital. Does that hurt you there? Does it make it worse?
No, it makes it worse.
How about here? Yeah. You have a diagnosis of pancreatitis, inflammation of the pancreas.
How are we going to diagnose this disease?
Well, they do some enzymes. They check the levels, as you know, in the blood. They do an MRI, CAT scan. Many of the times it'll show inflammation or something going on in the pancreas.
So the diagnosis is not that terrible. I mean, you can definitely reach a diagnosis, and now you know what the patient has.
You know, anybody who drinks too much alcohol, people with gallbladder disease, people who have high cholesterol or triglycerides, as you said. Who else is at risk?
The diabetics are at risk for this condition. Also, patients that drink too much alcohol, like you said, but alcohol and medications. There's a lot of medications, blood pressure pills, cholesterol pills, that when you read it says risk for pancreatitis.
Well, not only that, remember the pancreas produces insulin. So people can become diabetic if the pancreas is not working the way it needs to be.
Yeah, pancreatitis, chronic pancreatitis that happens a lot is going to damage your pancreas. You're going to run into a lot of trouble with that.
What do you normally do to treat that?
Well, the patients go on a bowel rest, and sometimes they have to have a little tube to the nose to kind of take fluids out of the stomach